Hi, this is Chris Brown from Emergent Fitness with this week's Coach's Corner, and this is going to be a two-part series about risk. Today we're talking about the assumption of risk and why we should think about risk when we consider our training. And then next week we'll look a little bit about how to assess the risk of specific exercises and specific workouts and how those might match up with the level of risk we're willing to tolerate. So when we think about risk and assuming risk, there's a few things to consider. First off, our education is going to play a huge part of us assessing the amount of risk that might be involved in an activity. So before we start a new activity that we think might have a high level of risk, whether that's rock climbing or skydiving, we're going to spend some time learning about the activity, either through books or online, or maybe we have a friend that's an expert in that activity. And then once we start participating in the activity, we're going to gain more experience that will help us do things to reduce the risk. And clearly, some of those experiences might be mistakes or things that lead to problems. And then we're going to attempt to do better next time in an effort to mitigate the risk of that same thing happening again. And assuming risk ultimately comes down to personal responsibility. We have to make a decision about whether we're going to participate in the activity or not. However, in many situations, we will delegate that personal responsibility to someone else. And the problem there is that sometimes we don't do that with as much intention or thought as maybe we should, or we assume that the person we're delegating that responsibility to has more education or experience than they really do. A good example to look at when we're considering risks is to look at the field of medicine. Managing risk is a big part in a whole industry within itself when it comes to medicine, and part of that's because modern Western medicine is based on the Hippocratic Oath, which says that doctors should do no harm. And as a result of that, if they do something that causes us harm, especially if that happened as a result of them not having enough education or experience, which is often called when they're being negligent, we have the recourse of suing them for malpractice. So as a result of that situation, the burden of risk in the case in most medicine then lies on the provider, the doctor, the hospital, the other healthcare professionals. And then the industry as a whole spends a lot of time and a lot of money on quality control. And they have statistics with anything that they're going to introduce. They do studies and pilot projects, and they have whole departments who spend time assessing and maintaining the quality of the service that they're providing, whether it's a doctor's office or a hospital, because they know they can get sued if they do cause harm or are proven to be negligent. So we can look at this continuum of who assumes risk in different activities. And obviously, as I just pointed out, for kind of routine medicine, you're going in for a treatment for a cold or something like that, the provider is assuming most of the responsibility, and we realize as patients that they're obligated to do no harm, and we're expecting them to have our health in mind when they're making their judgment. So we're usually willing to delegate quite a bit of our personal responsibility to the healthcare provider. Obviously, as the medicine gets less and less routine, we start looking at things like surgeries, we're going to spend more time getting educated about what it is that we're considering, so we can make part of that decision and assume a little bit more of the risk. As we move across the spectrum, you can see things like, guided adventure. This could be someone taking you hiking or climbing or mountaineering. The guide is probably going to make you fill out a pretty lengthy waiver, but waiver or not, they're there as a guide and you'll have the opportunity to sue them should you be able to prove them negligent if something bad happens during the activity. As we move farther over to things like martial arts and sports, we start to assume a little bit more of the risk as individuals. We're going to expect that the facility that we're doing the sport or martial art in is safe and clean and organized, and if it's something that has an instructor, we're going to expect that the instructor has enough education and experience to teach us how to do the activity. But as individuals, we realize that there's some danger involved if anytime we're maybe fighting with another person in martial arts, or if we're playing a sport like soccer or basketball and we pivot and roll an ankle or tweak our knee, we're assuming the risk for that activity. Same's true when it comes to driving, and the risks here are high enough that we're required to have insurance for our driving. And then maybe on the far end of this continuum are jobs that are very hazardous, things like being in combat, being a police officer, fighting fires, those sorts of things where there's an assumed amount of risk by the individual that they may very well be injured or killed as a part of their activity. So there's this continuum there of who's responsible and how much of our personal responsibility we're delegating to another person. And that brings us to thinking a little bit about the perception of risk. So oftentimes we have ideas about how risky any activity is that in reality aren't accurate. There is also a level at which we want to balance the amount of risk we're willing to accept based on the return on investment. So, for example, it may be safer for me to never leave my house, but it's going to be hard for me to earn a living if I'm not willing to leave the house and travel to a job. And so I'm going to be willing to accept a certain amount of risk, in this case driving to a job, in order to get a higher return on investment for my time. In a lot of cases, there's also a lack of data when it comes to risk. Even when it comes to sports, it's sometimes hard to get data about how many injuries there are or what caused those injuries. And in a lot of cases, the injuries tend to remain hidden because if you're participating in an activity, often people that get injured doing that activity don't return to the activity. So if you're participating or if you're a new participant, you have no idea who was hurt doing that activity in the past because they're not around anymore, and the provider may not choose to tell you about injuries that happened before. So when we're thinking about perceived versus real risks here, we do have some data. The data for this chart came from the American College of Sports Medicine, the ACSM, and you can see the different sports laid out in terms of how much risk. So the labels on the continuum here are a little bit different than earlier. We're looking at low versus high risk. And as you might expect, things like football, rugby, lacrosse, martial arts have a pretty high level of risk of injury. Most people may not realize that cheerleading is right up there and that basketball and soccer fall right behind. It's because all of those activities are still contact sports in some way, and they often involve a lot of change of direction as well. And so anytime you are trying to change direction while being at risk of being hit by another person, there's a pretty high risk that you might injure a knee, a hip, or an ankle. Running, and according to the ACSM, high-intensity dance aerobics, assuming things like step aerobics, fall right behind basketball and soccer. And skiing and tennis, and then resistance training, and this is both resistance training with machines and with free weights. They both had the same amount of risk involved when the ACSM did this study. And this might be surprising to people, and this is a good example of that perceived versus real risk. A lot of people perceive weightlifting or weight training to be dangerous, when in fact it's much less dangerous than something like basketball or soccer or even running, which we often just assume are not dangerous activities.